We're going to do that old familiar fascia restriction at that right hip over here. Good. And pull, right? And you could see right now that the posture has adapted, right? You could see the muscles are distorted, but you can see the posture is adapted. And I'm going to take the skeleton model in a second, and we're going to stay in this position so you can visualize as that is happening on the outside. Go ahead and grab for me so you can kind of sustain that fascial restriction. That's it. Good, right? So we've got that fascial restriction. And then let's look at what that does. Specifically, let's look at the lumbar spine. Look at that side bend, okay? And if we're going to really take a look in here, what happens when that is pulling to the right like that is the facet joints on the right close down and the discs gently pinch. And as they pinch, they migrate out to the left side, and the vertebral disc gap open and the discs are going to get pushed over to the left, which can cause interesting disc bulges and disc herniation and that kind of stuff. I'm going to give you a visual of what that looks like on the inside of the spine using just a small little prop, right? So as the spine, if the spine is straight, the discs are sitting like this, right? These blocks right between your vertebrae, you're fine. But as we are bent to the right, they literally fan open on the left and migrate out to the left. And in this position, they're at higher risk of disc herniation, not to mention if you've got this going on, and then what, you bend down and try to pick up something off the floor for me? If you're going to bend down and pick up something off the floor, basically the disc is now pushed to the left and out the back. Come back up. And disc herniation always occurs posterior, almost always. Literally, I'm going to be conservative, 98%. So really important to think of, right? You may get surgery for that disc, but if that fascia is still pulling you, that disc might still, right, above the one that you corrected, might still want to head out. So really important to look at that. And let's let that go, right, and release. So remember, right, when you are standing more upright, if you don't have that restriction, your discs are safe in between your vertebrae, nicely stacked. If we're bent, out they go over to one side and pinch on the other side.